You're getting ready for Nclex. Don't scroll past this. Today I'm revealing the top Nclex questions that repeat every single year, and I'll show you exactly how smart students use them to pass on their first try. Question 1. A client with shortness of breath, oxygen sat 86% on room air, HR 118, and BP 110/70, is waiting with 3 others for triage. Who should the nurse see first? A. Client with ankle sprain and severe pain, rated 9 out of 10. B. Client with dizziness after standing up quickly. C. Client with fever 38.3 degrees Celsius and productive cough. D. Client with shortness of breath and O2 sat 86%. The correct answer is D. Rationale. Airway and breathing issues take priority over circulation and other problems. Strategy. Use ABCs and acute versus chronic to set priorities. Question 2. Which task is appropriate to delegate to an experienced UAP working on a medical surgical unit? A. Teaching a client how to use an incentive spirometer. B. Assessing pain after a procedure. C. Obtaining a routine morning weight. D. Evaluating response to a diuretic. The correct answer is C. Rationale. UAPs perform routine, stable tasks such as weights and vital signs. Strategy. Delegate stable, predictable tasks without assessment, teaching, or judgment. Question 3. Which client needs airborne precautions? A. Pertussis. B. Influenza. C. Varicella. D. MRSA wound. The correct answer is C. Rationale. Varicella requires airborne precautions, N95 negative pressure. Strategy. MTV for airborne, measles, TB, varicella. Question 4. What is the correct order to don PPE for contact precautions? A. Gown, mask, goggles, gloves. B. Mask, goggles, gown, gloves. C. Gown, gloves, mask, goggles. D. Goggles, gown, gloves, mask. The correct answer is A. Rationale. Correct order is gown, mask, goggles, gloves. Strategy. Remember GMGG. Question 5. What is the correct order to remove PPE after contact precautions? A. Gloves, goggles, gown, mask. B. Mask, gown, goggles, gloves. C. Gown, gloves, mask, goggles. D. Goggles, gloves, mask, gown. The correct answer is A. Rationale. Remove dirtiest first. Gloves, goggles, gown, then mask. Strategy. Dirtiest to cleanest. Question 6. When mixing regular insulin and NPH in the same syringe, what is the correct sequence? A. Draw NPH first, then regular. B. Draw regular first, then NPH. C. Either order is acceptable. D. Do not mix these insulins. The correct answer is B. Rationale. Draw clear, regular, before cloudy, NPH. Strategy. RN equals regular, then NPH. Question 7. A diabetic client is sweaty, shaky, and confused. What is the priority action? A. Administer glucagon IM. B. Give 4 ounces of juice. C. Start an insulin drip. D. Notify the provider. The correct answer is B. Rationale. Conscious hypoglycemia is treated with fast-acting carbs. Strategy. Treat before you chart or call. Question 8. Which finding is most consistent with DKA rather than HHS? A. Severe dehydration without acidosis. B. Kussmaul respirations and fruity breath. C. Extremely high blood glucose greater than 800 milligrams per deciliter. D. Neurologic deficits without ketones. The correct answer is B. Rationale. DKA equals acidosis, ketones, Kussmaul respirations. Strategy. DKA equals diabetic ketoacidosis. Question 9. Which ECG change is associated with hyperkalemia? A. U waves. B. Peaked T waves. C. ST elevation. D. Prolonged QT interval. The correct answer is B. Rationale. Tall, peaked T waves indicate hyperkalemia. Strategy. High K equals high peaked T. Question 10. Which finding indicates digoxin toxicity in an adult? A. Tinnitus. B. Yellow-green vision changes. C. Polyuria. D. Hypoglycemia. The correct answer is B. Rationale. Visual disturbances and bradycardia signal toxicity. Strategy: always check apical pulse first. Question 11. A client on lithium reports diarrhea and tremors. Which is the best action? A. Encourage fluids and recheck later. B. Hold the dose and notify the provider. C. Give an antidiarrheal. D. Administer the next dose early. The correct answer is B. Rationale: lithium toxicity ranges 0.6 to 1.2. Strategy: GI upset plus tremors suggests toxicity. Question 12. Which lab guides IV heparin therapy? A. INR. B. APTT. C. Platelets only. D. PT only. The correct answer is B. Rationale: heparin is monitored with APTT, warfarin with PT-INR. Strategy: heparin to PTT, warfarin to INR. Question 13. During a blood transfusion, the client develops chills, low back pain, and hypotension. Priority action: A. Slow the transfusion rate. B. Stop transfusion and keep IV open with normal saline. C. Administer acetaminophen and continue. D. Reassess in 15 minutes. The correct answer is B. Rationale: classic hemolytic reaction, stop blood, keep line open. Strategy: stop the transfusion first. Question 14. An IV site is cool, pale, and swollen with slowed rate. What is it? A. Phlebitis. B. Infiltration. C. Infection. D. Air embolism. The correct answer is B. Rationale: infiltration equals cool and swollen site. Phlebitis equals red, warm site. Strategy: stop the infusion and restart elsewhere. Question 15. A chest tube slips out on a client with a pneumothorax. First action: A. Reinsert the tube. B. Cover the site with sterile occlusive dressing taped on 3 sides. C. Apply a warm compress. D. Increase suction. The correct answer is B. Rationale: prevent air entry but allow exit. Strategy: airway and breathing first. Question 16. After a total thyroidectomy, which position is best? A. Flat supine. B. High Fowler's with neck supported. C. Trendelenburg. D. Side lying with neck hyperextended. The correct answer is B. Rationale: elevate HOB, support neck to reduce swelling and protect airway. Strategy: airway protection is key. Question 17. Which assessment best indicates safe swallowing after stroke? A. Strong cough and clear voice after sipping water. B. Loud voice when talking. C. No drooling when sleeping. D. Normal gag reflex. The correct answer is A. Rationale: ability to clear secretion suggests safe swallowing. Strategy: watch for cough, wet voice, and pocketing. Question 18. An exacerbated COPD client on 6-wear nasal cannula is drowsy. What should the nurse do first? A. Increase oxygen to 10 liters per minute. B. Lower oxygen to 1.2 liters per minute and reassess. C. Discontinue oxygen. D. Give naloxone. The correct answer is B. Rationale: too much oxygen can depress breathing in COPD. Strategy: use the lowest effective O2. Question 19. Which medication is a short-acting beta agonist for acute asthma symptoms? A. Salmeterol. B. Fluticasone. C. Albuterol. D. Montelukast. The correct answer is C. Albuterol is a rescue inhaler. Strategy: rescue equals rapid. Question 20. A client on lisinopril develops a persistent dry cough. Best action: A. Continue drug, cough is harmless. B. Discontinue abruptly. C. Notify the provider to consider ARB substitution. D. Double the dose for effect. The correct answer is C. Rationale: ACE inhibitors often cause cough. ARBs are alternatives. Strategy: no class adverse effects. Question 21. A client with 30% TBSA burns is 8 hours post-injury. Which finding requires immediate action? A. urine output 20 milliliters per hour. B, pain 8 out of 10. C, mild edema of hands. D, oral temperature 37.8 degrees Celsius. The correct answer is A.
Low urine output signals poor kidney perfusion and inadequate fluid resuscitation. Strategy. In burn patients, urine output guides adequacy of fluids. Question 22. Which is expected in Addison disease? A, hypertension and hypernatremia. B, hyperpigmentation and hyperkalemia. C, truncal obesity and moon phase. D, hyperglycemia and fluid overload. Correct answer B. Rationale. Addison disease equals low cortisol aldosterone, leading to hyperkalemia, hypotension, hyperpigmentation. Strategy. Addy skin helps recall the hyperpigmentation. Question 23. Which finding is consistent with diabetes insipidus, DI? A, low serum sodium and concentrated urine. B, high urine specific gravity. C, polyuria and high serum sodium. D, weight gain and low urine output. Correct answer C. Rationale. DI leads to polyuria, dehydration, and hypernatremia. SIADH equals water retention and hyponatremia. Strategy. DI equals dry inside. Question 24. Which is a probable sign of pregnancy? A, fetal movement felt by mother. B, positive urine HCG. C, fetal heartbeat by Doppler. D, ultrasound visualization of fetus. Correct answer B. Rationale. Probable equals objective signs like HCG. Positive equals definitive signs like fetal heartbeat or ultrasound. Strategy. Distinguish presumptive, probable, positive. Question 25. Which finding in a 34-week client with preeclampsia is most concerning? A, 1+ proteinuria. B, headache and blurred vision. C, mild dependent edema. D, BP 138 over 88. Correct answer B. Rationale. Neural signs indicate severe preeclampsia and seizure risk. Strategy. Think magnesium sulfate for seizure prevention. Question 26. What is the correct use of a bulb syringe for a newborn? A, mouth then nose. B, nose then mouth. C, alternate nostrils only. D, use only if choking. Correct answer A. Rationale. Clear mouth first to prevent aspiration. Strategy. M before N. Question 27. Which APGAR component scores 0 if absent? A, appearance, pulse, grimace, activity, respiration. B, appetite, pulse, grimace, activity, respiration. C, appearance, pupils, grimace, atrophy, respiration. D, alertness, pulse, growth, activity, respiration. Correct answer A. Rationale. APGAR equals appearance, pulse, grimace, activity, respiration. Strategy. Memorize APGAR components.